Now let's talk about bipolar disorder in Chinese medicine. Bipolar disorder follows closely the symptoms of the ancient Chinese disease of Tian Kuang, which may be translated as dullness and raving or dullness and mania. Tian Kuang does not necessarily correspond exactly to bipolar disorder. Tian is not depression as we intend it in Western psychiatry. Tian could correspond to schizophrenia. Epilepsy was often confused with Tian of Tian Kuang in the past. Tian Kuang itself may correspond to schizophrenia. Pathology of Tian Kuang. In Tian Kuang, there is always a disharmony of yin and yang. In mania, there is an excess of yang, such as fire. In this condition, there is an excess of yang also in the sense that yang is rising to the top of the body. In dullness, there is, broadly speaking, an excess of yin in the form of phlegm and qi stagnation. Of course, that is not to say that there is no phlegm in mania, as there certainly is, but it is usually combined with fire. Central to the pathology of Tian Kuang is phlegm, and both the depressive and the manic phases are due to obstruction of the mind by phlegm. This is a major difference between the depressive phase of bipolar disorder or Tian Kuang, dullness, and depression. In depression, there are many patterns without phlegm. Moreover, the depressive and the manic phases of bipolar disorder, although so different from each other in their manifestations, are really two sides of the same coin. The constraint of qi-induced emotional stress usually leads to heat and fire. In manic depression, there is nearly always fire, which, together with phlegm, accounts for the rash behavior during the manic phase. Fire combines with phlegm and it harasses upwards to agitate the mind while the phlegm obstructs it. The fire harassing upwards derives primarily from the liver and heart. The chi stagnation caused by emotional stress in time leads to blood stasis. This is a feature of chronic cases of manic depression and one that complicates the conditions of phlegm and fire. The essential pathology in bipolar disorder is the excessive coming and going of the ethereal soul, even in its depressive phase. The ethereal soul gives the mind inspiration, creativity, ideas, plans, life dreams, and aspirations. This psychic energy is the result of the coming and going of the ethereal soul, and it is the psychic manifestation of the free flow of liver chi, and in particular, the physiological ascending of liver chi. There are two possible factors leading to this situation. If the mind is weak and fails in its restraint and control, the ethereal soul may be too restless and its movement excessive, only bringing confusion and chaos to the mind, making the person restive, unsettled, and to some degree manic. On the other hand, the movement of the ethereal soul may in itself be excessive, not because the mind is failing to control it. The result is the same, that is, an excessive amount of ideas, life dreams, plans, and projects flowing out of the ethereal soul and making the person to some degree manic. So we have here an illustration of the two situations when the coming and going of the ethereal soul is excessive, either in itself on the left-hand side and or because the mind does not control it enough on the right-hand side. If the movement of the ethereal soul is excessive, contents breaking through from the ethereal soul cannot be integrated by the mind. The mind should integrate the ethereal soul so that images, symbols, and dreams coming from it can be assimilated. When the coming and going of the ethereal soul is excessive, there is a steady and excessive stream of ideas, inspiration, and plans flooding the mind. In serious cases, this can lead to mania. Whenever the coming and going of the ethereal soul is excessive, there is the possibility of manic behavior. Thus, in mania, there is always an excessive movement of the ethereal soul. Now let's go to the symptoms of mild mania. in normal individuals. Mental restlessness, agitation, hyperactivity, working and being active at night, spending a lot, having many projects simultaneously, none of which comes to fruition, mental confusion. It is interesting to note that people suffering from bipolar disorder are often artistic. Or to put it differently, among famous artists, there is a disproportionate incidence of bipolar disorder. This is due to the fact that the artistic inspiration derives from the ethereal soul. Therefore, the same psychic energy of the ethereal soul that makes someone artistic in pathological conditions may also make them mentally ill. During manic episodes, the bipolar patient is bristling with ideas. He or she is inspired, feelings intensify, sensations are keener, and he or she often writes poetry. Another symptom would be talking a lot, propensity to take risks, and they're often artistic.